toll-free at 1-877-526-9090.
When it comes to scary tropical diseases, you can't get much scarier than malaria. I mean, every year in developing countries, it kills nearly 1 million people, and way too many of those people are kids. You might not know that Canada is now at the forefront in the battle against the disease. It's the primary focus of a new global health organization, of which my next guest is a part. Dr. Peter Singer is director of the McLaughlin-Rotman Center for Global Health. He joins me now in studio. Good to have you in the studio with us. Peter, first of all, how is Canada doing something unique in this fight against malaria in the developing world?
Well, the announcement today launched Grand Challenges Canada, an organization funded with $225 million to identify grand challenges, support a community of researchers from the developing world in Canada to tackle those challenges, and make sure that resulting technologies get to the people who desperately need them. So to take a concrete example, a child comes to the clinic with fever, child under 5 years of age. You don't know whether it's malaria, whether it's pneumonia, whether it's something else. What happens today is the sample gets sent off to a laboratory 100 miles away. By the time the results come back, it's too late to make a decision about treatment. Our first grand challenge is on point-of-care diagnostics. So instead of a big, bulky microscope 100 miles away, these little test strips that help you test the cause of that child's fever, find out right away, you can institute the appropriate treatment. That's a way to save at least 100,000 lives from malaria alone, not to mention the other causes of fever of children under 5.
And easy to perform, this test strip?
Well, that's the whole point. These are the mobile phones, if you will, of global health. You know, just the same way you don't need landlines. In this one, you bypass the laboratories, the infrastructure, and they can be provided right at the patient's bedside, right away, by health workers. So it's a much better way to diagnose problems and to institute treatment.
What do you see when it comes to malaria in the world? I mean, people would have thought, that's a disease that's gone by the wayside.
You know, the problems, the challenges of global health are tragic. Malaria, for instance, kills 1 million people a year, most of them children under 5 in Africa. Do you know, if you're a child under 5, you've got a 13 times greater chance of dying in the developing world and in Canada. That is just not right, and Canada is now going to do something about that with the launch of Grand Challenges Canada, which will focus, working with the Bill and Melinda Gates Foundation, its first Grand Challenge on diagnostics, and this is about innovation and global health.
When it comes to malaria, what makes it so difficult to control, though?
Well, what makes it difficult, in part, the first step in the control of any disease is the diagnosis. I was a practicing doctor. You can't treat somebody adequately if you don't have the right diagnosis. And that's why diagnostics are so important. But the key issue is innovation. How can we do things better? So 10 years from now, we're doing things, and colleagues in the developing world are doing things differently and better and saving lives through innovation, and that's what this announcement today is about.
I want to ask you one final question, and that is back to the subject of malaria, because I want to focus on that and the key tool that you've brought in today. Is it growing in some parts of the world? I mean, are there areas where you see the numbers just rising exponentially when it comes to that?
You know, malaria comes and goes. At the moment, the numbers are falling. But this is an important issue. You know, 1 million kids dying every year of malaria is 1 million kids too many dying every year of malaria. So to really make some further inroads, we need innovation on that final push, like the type represented by Grand Challenges Canada, launched today by the Government of Canada through the Development Innovation Fund.
Peter, thank you so much for joining us. It's Dr. Peter Singer here in the studio. Have a great day.
Thank you, Suhana.
A hard rain continues to come down on the massive tent city in Haiti.